The Pain Pod is produced by Bloodstream Media and made possible thanks to our sponsor, Tremo Pharmaceuticals. Visit resethastudy.com to learn more about their work.
Hi, and welcome to this episode of The Pain Pod. Back to basics, an introduction to pain management. In this episode, we will discuss the basics of chronic pain and present key takeaways from clinicians, advocates, and patients to help you on your journey. This is an introductory episode for those just beginning their journey. This is a refresher episode intended for all who experience chronic pain, no matter where you're at on your journey. We will begin with the basics and discuss when to seek professional help for chronic pain. Then, we will explore ways to advocate for yourself and your needs. And lastly, we will hear from a patient about their experience navigating chronic pain. Hopefully, with these basic tools and takeaways, you too can keep moving forward in your journey with pain. I'm Mel Forrest, and welcome to the Pain Pod.
Being a patient is a job, and you have to show up for your job.
Settle down, everyone. Class is in session. Hello, and thank you for being here today. They say the hardest part is starting, so I want to congratulate you on showing up for yourself today. In this episode, we will discuss various ways to approach pain management that can keep you moving forward even with pain. So, if you're new to chronic pain or just want a refresher on how to approach and manage your pain, you've come to the right episode. And there's no better place to start than at the beginning. Chronic pain is pain that lasts over 3 months. It can be present all of the time or come and go. Dr. Jennifer Huggins, a clinical pain psychologist in Los Angeles, explains what chronic pain is and why it persists.
My name is Dr. Jennifer Huggins. I'm a clinical pain psychologist, and I had my own chronic pain for a long period of time, about 10 years. And from a mind-body syndrome perspective, I've been pain-free for about 13, 14 years.
Lesson 1. What is chronic pain?
So, what starts pain is not always what maintains pain. So we may correctly or incorrectly attribute a particular incident or what we might call an injury to be the cause of the pain. Let's say it's an injury. Let's say someone falls and they develop knee pain. Injuries heal. They heal, and the body is very well designed to heal. I believe the American Medical Association changed it, but it used to be, like 6 months was the cutoff for chronic pain. 6 months or more, we would call it chronic. 6 months or less, we would call it acute. Now it's 3 months. So like the femur bone, which is the thickest, biggest bone in the body, heals within 6 month period, let's say. So injuries heal, but what doesn't always go away is the pain signal.
What is a pain signal? To keep it brief, a pain message is transmitted to the brain by specialized nerve cells known as nociceptors, or pain receptors. When pain receptors are stimulated, they release neurotransmitters, or messengers, which then transmit the pain signal from the pain receptor to the spinal cord and then to the brain, where the pain signal is processed. Got it?
So sometimes the pain signal, it gets trapped in the nervous system due to a series of reasons. The climate of a person's life around the time that the injury occurred, their nervous system activity, what was happening around that time, what they were told was going to happen for them can also be a really interesting variable that can influence the course of pain. So, for instance, somebody might be told, be careful when you bend, and, this may not go away, or some fear-based messages. And depending on the person, let's say they become really consumed by that, really worried about that. And really, what if this pain doesn't go away? And they're very focused on the pain. Sometimes that in and of itself, that worry, that fear, can lead to nocebo effect, which is like belief that harm leads to harm, and a perpetuation of chronic pain.
As a clinical pain psychologist, Dr. Jennifer Huggins provides a psychological interpretation on why pain persists, causing it to become chronic. But as we know, pain is personal and everyone is on their own journey. Seeking guidance from various providers and finding what fits best for you and your experience becomes necessary in order to keep moving forward. Marissa Kors is a sickle cell patient, patient advocate, and founder of the Sickle Cell Experience Live. She gives insight and guidance on how to prepare for your visit with your provider for pain and how to advocate for your needs.
My name is Marissa Kors. I am a fifth-generation sickle cell patient and patient advocate, and my chronic pain illness is sickle cell disease.
Lesson 2. How to advocate for you and your pain.
Well, for the most part, this is not your fault, but it is your responsibility. It is my responsibility at all times to not only manage the outcome, but to look 5-10 steps ahead to try and manage what might be coming down the pipeline.
Marissa offers 4 things that may be helpful when seeking treatment for pain. Number 1.
First and foremost, you cannot allow your value to be attached to the healthcare system.
You have options, you have choices, and you have value. Number 2.
You are the expert. You are the expert on you and your body. And can't nobody take that from you.
Pain is above all personal, and you are the expert of your experience. Number 3.
Know your medical history. Know your medications. Know what works for you.
And lastly, number 4.
Learn the art of negotiation. When you're dealing in a world of healthcare, you have to come up with a plan B.
Marissa shares a personal experience where having a plan B was necessary for pain relief when seeking treatment at a hospital for a sickle cell crisis.
So we're taught that the pain has to be handled immediately. There's an urgency there because that pain is but an alarm. You're always sickling. Your red cells are always imploding. They're always only releasing 10% of the oxygen they're carrying. And this is happening every second of every day. So that damage is constantly happening. You have to understand that they have rules and unspoken rules and whatnot. So you have to have a plan B. We know IV pain medication, a lot of it frequently get the pain under control. But when you come up against somebody that says, I'm flat out not going to do that, then you have to have a plan B until you can get to the person that understands.
Talking to a provider about pain can be overwhelming and exhausting, but don't worry, you're on the right track. And always know that there are patient advocates like Marissa who want to help you along the way. In our next lesson, we will hear from a patient about their experience navigating chronic pain. But at this moment, let's take a brief break to enjoy this word from our sponsor.
The Pain Pod is produced by Bloodstream Media and made possible thanks to our sponsor, Tremo Pharmaceuticals. Visit resethastudy.com to learn more about their work.
I don't actually think about the things I can't do.
This is Mark Corrigan, the President of Research and Development at Tremo Pharmaceuticals.
I had dealt with some fairly severe chronic pain for about 2 years when I couldn't walk following a skiing accident. Since then, the pain comes and goes, and I've kind of learned to live with it.
Life goes on even when chronic pain persists. Mark shares how he approaches living life while dealing with daily pain.
One of the things I have to be careful is that if I overdo it, I will be suddenly in a fair amount of pain, and that can set up for a month or 2 months. I want to keep active. I'm 65, and so keeping active is really important to me, maintaining flexibility, and also understanding where that line is, where if I cross it, I'm going to pay a price.
As we emerge from the last 2 years, it can be hard to accept our own limitations. Mark understands this, but offers some hope on the subject.
I don't actually think about the things I can't do. I think about I can cycle, I can play with my grandchildren, I can walk about a mile, and it's particularly on level ground, and I can play golf badly, but golf nevertheless. And so those things are really pleasurable for me, and I really focus on those. And so psychologically, I don't see myself as disabled. I don't see myself as in chronic pain.
So as the world begins to reopen, I asked Mark, what are you looking forward to in the near future?
Golf.
Hi, I'm Patrick. I have hemophilic arthropathy, or permanent joint disease and chronic pain as a result of hemophilia-related bleeding. And like many of my fellow blood brothers and sisters, finding the safest and most effective ways to manage my HA has been somewhat challenging at times. That's why I'm in support of Tremeau's Reset HA study. Tremeau was founded with the goal of developing and delivering non-opioid pain therapies for people living with pain. Tremeau's Reset HA study is a clinical research study for people who experience joint pain due to hemophilia. The study's evaluating an oral, non-opioid, investigational drug designed to be taken once a day to see if it may potentially help relieve joint pain and improve physical function in people with hemophilic arthropathy. You may be eligible to participate in this clinical research study if you are between the ages of 12 and 75, have been diagnosed with hemophilia A or B, have chronic pain in one or more joints, and do not take opioid medication more than 4 days a week. If you are interested in learning more about taking part in Tremeau's Reset HA study, visit resethastudy.com. That's resethastudy.com to find a study location near you. Reset the way you manage your pain. Visit resethastudy.com today.
Hello, and welcome back to Basics, an introduction to pain management. As a reminder, you may pause and rewind this episode at any point to review anything you may have missed. So far in this episode, we've talked with a clinician and patient advocate about why chronic pain persists and how to approach treatment when it does. In our final lesson, we will catch up with Cassandra Campos McDonald, a chronic pain patient, about where she's at in her journey with pain and what keeps her moving forward.
My name is Cassandra Campos McDonald. I go by Kaz. I deal with chronic neck and back pain.
Lesson 3, how to move forward.
I'm feeling pretty good. It's a good morning. Weather has been kind of weird, it sort of makes your pain do some funny things, but overall, I feel like I'm in a good place.
Throughout Season 2 of the Pain Pod, we spoke with Kaz about her journey with chronic pain, the beginnings, the ups and downs, and her hopes for the future. If you'd like to hear more about Kaz's journey, you can find Season 2 episodes on bloodstreammedia.com. But for now, we will hear how things have changed to help her move forward with pain.
One of the things that's changed is I went to a second opinion. I saw another pain doctor, and it has proven to be really good. I'm a big proponent for people seeing second opinions. It's just a hassle, it really is, just to figure out where you're going and saying your story all over again. But gosh, it can really be worth it when you go to another professional that really has, new eyes on your situation and can maybe explain some things that you haven't really understood in the past because you just sort of live with them. So I'm really fortunate. I found someone that's been really good for me. One of the things that I have added to my pain management is weekly massage therapy, because there was a time where I couldn't even handle a massage. It was just too painful. And over the past year or two, I finally have gotten to a place where I could handle it, and it has been a wonderful thing for me. And I'm seeing the chiropractor less often and the acupuncturist less often. And my acupuncturist told me one time, he said, ideally, you want to do more massage and then maybe acupuncture. And, he sort of went down a list of what the ideal things were. And I finally got to that point. And I think it really makes a lot of sense, at least for me. And so I am just so, so grateful to have this opportunity to do that and incorporate it into my well-being, my plan.
By advocating for herself and her needs, Kaz was able to incorporate new pain management techniques into her overall plan for well-being. Kaz is in a better place, but understands that this is still an ongoing process and offers some advice to those who may feel stuck.
Gosh, if anybody's listening that is doubting going for a second opinion, do yourself a favor. Do yourself a great big favor, because it just could be a life-changing appointment. And it may not be, and that's okay. But, there may be something different, something new. I mean, medication, therapies, things change. They change, they get better. And that's why I'm just always hopeful for what is going to be out there. And we just do what we can to feel better and to keep moving, to keep moving forward and not just being stuck and being mired in our pain. You need to find something that's going to feed your soul, to keep you busy, to help you move forward. You're probably still going to be in pain, but you want to get to the point where you can do that. So what are the things that we can do that aren't going to take away who we are? Because I think pain can take away who we are if we let it. And I refuse to let that happen. So I'm stubborn.
As we've heard today, there are many things that a person can do to keep moving forward with pain. But knowing you have worth, trusting your instincts, asking the right questions, and tapping into what feeds your soul and makes you, you, are our key takeaways this episode that will keep you moving forward no matter where you are on your journey with pain. Thank you for participating in Back to Basics, an introduction to pain management. If you'd like more information, you can find resources and links in the show notes of this episode.
I missed a lot. I missed homecoming dance that year because I was in so much pain I couldn't even leave my bed.
We talk with young people and experts about pediatric pain and what it takes to move forward. Next time on The Pain Pod. The Pain Pod is written and hosted by me, Mel Forrest. Produced by Keith Corneluk. Edited by Jose Miguel Baez. Artwork by Ryan Gielen and Christina Newhard. Post-production support from Joshua Sterling Bragg, Rob Bradford, Allison Stoney, and Ava Friedman. And executive produced by Patrick James Lynch. The Pain Pod is produced by Bloodstream Media and presented by Tremo Pharmaceuticals. Tremo's RESET-HA study is a clinical research study for people who experience joint pain due to hemophilia, and you can learn more about it by visiting resethastudy.com. And as always, if you like this episode, make sure to subscribe, rate, and share The Pain Pod. Thanks so much for listening. I'm Mel Forrest, and we'll be back next time with episode 3 of The Pain Pod.